Understanding Tuberculosis, a comprehensive guide. What is tuberculosis? Tuberculosis, TB, is a contagious bacterial infection caused by Mycobacterium tuberculosis. It primarily attacks the lungs but can affect other parts of the body such as the brain, kidneys, and spine. TB is spread from person to person through airborne particles expelled when an infected individual coughs, sneezes, speaks, or sings. Though it is preventable and curable, untreated TB can be fatal. Types of tuberculosis. 1. Pulmonary TB. This is the most common form and occurs when the bacteria infect the lungs. It can be highly contagious and often presents with symptoms like chronic cough, chest pain, and coughing up blood. 2. Extrapulmonary TB occurs when TB spreads beyond the lungs to other organs such as the lymph nodes, pleura, bones and joints, genitourinary tract, or central nervous system. It is more common in immunocompromised individuals. 3. Latent TB infection, LTBI. In this condition, the TB bacteria remain in the body in an inactive state. The person does not exhibit symptoms and cannot transmit the disease. However, LTBI can progress to active TB if not properly managed. For active TB disease, this occurs when the immune system fails to contain the latent infection, allowing bacteria to multiply and cause symptoms. This form of TB is contagious and requires prompt medical treatment. Causes and risk factors. 1. Infection with Mycobacterium tuberculosis. The primary cause of TB is infection by this bacterium. 2. Airborne transmission. TB is transmitted through the air when an infected person releases respiratory droplets. 3. Weakened immune system. Conditions like HIV, AIDS, diabetes, or cancer, as well as organ transplants and immunosuppressive therapy, increase susceptibility. 4. Living conditions. Poor ventilation, overcrowding, poverty, and malnutrition facilitate the spread of TB. 5. Age and occupational exposure. Elderly individuals and healthcare workers are at greater risk. Symptoms of tuberculosis. Persistent cough lasting more than 3 weeks. Chest pain. Hemoptysis, coughing up blood. Unexplained weight loss. Severe fatigue and weakness. Night sweats. Fever and chills. Loss of appetite. In extrapulmonary TB, symptoms vary depending on the affected organ, e.g., back pain in spinal TB, headache in TB meningitis. Diagnosis of tuberculosis. 1. Mantoux tuberculin skin test, TST. A small amount of tuberculin is injected under the skin. The injection site is examined after 48 to 72 hours for a reaction. 2. Interferon gamma release assays, IGRAs. A blood test that measures immune response to TB bacteria. Examples include the QuantiFERON-TB Gold test. 3. Chest X-ray detects abnormalities in the lungs such as infiltrates or cavities. 4. Sputum microscopy and culture, analyzing sputum samples under a microscope or culturing them to detect TB bacteria. 5. Molecular tests. Rapid diagnostic tools like GeneSpurt MTB, RIF detect TB and resistance to rifampicin. Treatment of tuberculosis. 1. Antibiotics regimen. O. Initial phase, 2 months isoniazid, rifampicin, pyrazinamide, and ethambutol. O. Continuation phase, for months isoniazid and rifampicin. 2. Directly observed therapy. A healthcare provider supervises patients as they take their medications to ensure adherence and completion. 3. Treatment for drug-resistant TB requires second-line drugs and a longer duration, often up to 20 months or more. Managing tuberculosis. Seek immediate medical attention if you have symptoms. Ensure proper medication adherence to prevent resistance. Regular follow-ups with healthcare providers. Isolate during the initial weeks of treatment to prevent spread. Maintain a healthy lifestyle and avoid smoking. Dietary recommendations. Foods to eat. 1. Nutrient-rich foods. Emphasize unprocessed foods including fruits, especially citrus, vegetables, especially greens. Whole grains, lean meats, fish, legumes, and nuts. 2. Vitamin D sources, fatty fish, like salmon, fortified cereals, dairy products, and egg yolks. 3. High-protein foods, eggs, chicken, milk, legumes, and soy products to aid tissue repair. 4. Iron-rich foods, spinach, red meat, beans, and fortified cereals to combat anemia. 5. Zinc and selenium, found in seeds, nuts, and seafood, important for immune function. Foods to avoid. 1. Sugary snacks and beverages, reduce consumption of soda, candy, and pastries. 2. High-sodium foods, such as processed meats, chips, and canned soups. 3. Allergen triggers, avoid food allergens that may weaken immune responses. Recommended drinks. To include water, at least 8 to 10 glasses a day to stay hydrated. Herbal teas, such as ginger, turmeric, and peppermint tea to soothe inflammation. Fresh juices, orange, carrot, beetroot, and pomegranate juices support immune health. To avoid, sugary sodas impair immune function. Excessive caffeine can interfere with rest and cause dehydration. Alcohol weakens immune defenses and interferes with medications. Smoking and TB. Smoking damages lung tissue and hampers TB treatment effectiveness. It increases the likelihood of developing active TB. Quitting smoking reduces symptoms and improves recovery outcomes. Home remedies and supportive care. 1. Turmeric milk. Mix 1/2 teaspoon of turmeric in warm milk. Known for its anti-inflammatory and antibacterial properties. 2. Garlic has natural antimicrobial effects. Can be added to meals or consumed raw in small quantities. 3. Honey and ginger mix boosts immunity and soothes sore throats. 4. Steam inhalation helps relieve chest congestion. 5. Aloe vera juice may aid digestion and boost overall wellness. Note: home remedies should complement, not replace, prescribed TB treatment. Prevention of tuberculosis. BCG vaccine offers protection against severe TB forms in children. Regular screening, especially for healthcare workers and high-risk populations. Improve living conditions, ensure good ventilation and reduce overcrowding. Cough etiquette, use tissues or elbows to cover mouth and nose. Healthy lifestyle, a strong immune system can help fight TB bacteria. Tuberculosis remains a global health challenge, but with proper education, timely diagnosis, adherence to treatment, and supportive care, it is both preventable and curable. Always consult healthcare professionals if you or someone close shows signs of TB.